Mononucleosis is more popularly known by its short name, mono. This viral infection is transmitted from one person to another through saliva. We spoke with Dr. Stephen Beutler at Redlands Community Hospital, who has more information on this infectious disease.
Mononucleosis is an infection most commonly caused by the Epstein-Barr virus, which at one time or another affects almost everybody in the world. It most commonly causes symptoms in people who are between the ages of 15 and 30. And if you acquire the virus when you're much younger, you have either no symptoms or minimum symptoms. And older people don't tend to react to it the same way either. Back before much was known about the virus that caused mononucleosis, it used to be referred to as the kissing disease. And that may have to do with the age group that it affected. But it's also true that it's contagious through saliva. Patients with mononucleosis may develop many symptoms, but the most prominent and the most severe tend to be sore throat, fever, and swollen glands. Patients with mononucleosis also develop enlarged spleens and in some cases will feel a lot of abdominal fullness. There'll be fatigue, there'll be weakness, and there'll be muscle aches.
He explained how it's diagnosed.
Many cases of mononucleosis are diagnosed initially just based on their clinical presentation. But once the disease is suspected, there are a couple of blood tests that are very useful in establishing the diagnosis or confirming the diagnosis.
And we asked the doctor, how is it treated?
Generally, the treatment for mononucleosis is symptomatic. You give the patient things required to keep them comfortable. Sometimes they need fluids, sometimes they need antipyretics to keep their temperature down. But there's no specific medication that shortens the duration of mononucleosis.
As for the virus, how long does that stay in your system?
Mononucleosis can actually last for a long time. The most acute phase may last for 2 to 3 weeks, but it's not uncommon at all for patients to feel weak, washed out, and fatigued for months after the acute illness has subsided.
And finally, is mononucleosis life-threatening?
Generally not life-threatening. There are some complications that can be life-threatening. One of them is airway obstruction by large tonsils, and that can be sometimes treated with doses of steroids. The other life-threatening complication of mononucleosis is rupture of the spleen. The spleen gets enlarged in almost all cases of mononucleosis, and occasionally it'll rupture. One of the precautions people with mononucleosis have to take is avoidance of things like contact sports or climbing ladders for at least a month or so after they're feeling better, because the spleen may take a while to shrink and it's possible for it to rupture with even mild trauma. The virus stays in your system for your entire life, and occasionally the disease will reactivate, and occasionally you'll shed low levels of virus in your saliva.